inspired me to get excited about reproductive justice. Working with students like Khadija, who are doing amazing things for reproductive and social justice issues on campus, makes me hopeful about the future of our great state. As Earth continues to work in Ohio, we couldn't do it without the support of fellow reproductive health advocates. Amanda Patton is one of those amazing advocates and a great friend of mine. As a patient advocate for Founders Women Health Center here in Columbus and the creator of Pro-Choice Cats, Amanda is well-versed in the ins and outs of political intrusion and reproductive health in Ohio. Thank you so much for being with us today.
Thank you, Allie. Good morning. It is really encouraging to see all of you here today. As an employee of a local reproductive health clinic, I've seen over and over how important these health centers are to young Ohioans. I've also seen clinic harassment firsthand. Imagine for a moment that you're pulling up to your doctor's office just to find protesters knocking on your car window and impeding you from entering the parking lot. They knock on your window trying to get you to talk to them. You finally park, get out, and find yourself standing in front of a man who is shouting and holding a sign that implies you are a murderer. As you walk, that one man quickly becomes a mob of people who are telling you that this clinic isn't a safe place. Suddenly, you're frightened, pregnant, and outnumbered. This scene is a reality for women seeking abortion every day across the state at the few remaining clinics. Put yourself in their shoes and then tell me we don't need House Bill 408. Why are clinic protection laws necessary? Because there are people outside of clinics who harass and intimidate women who are just trying to get to their doctor appointments. Why are clinic protection laws necessary? Because protesters have stood outside of my doctor's home holding bloody fetus signs that say, "This doctor kills babies." Because Created Equal distributes Killer Among Us postcards that feature the photo and home address of abortion doctors. Why are clinic protection laws necessary? Because volunteer escorts have been verbally and physically accosted on numerous occasions outside of Columbus's abortion clinics. Because these legal medical clinics should not even need volunteer escorts to help patients feel safe when walking past protesters, and yet they do. I have always been pro-choice, but it wasn't my beliefs that made me want to work at an abortion clinic. It was actually the clinic harassment that pushed me to get involved. As I witnessed protesters following patients, staff, and volunteers outside of the clinic, I realized that our rights are literally being attacked. Women should not have to face a gauntlet just to get legal medical care. Physicians should not feel unsafe at their homes and workplaces. Women and healthcare workers deserve protection and the ability to safely report and prosecute anti-choice extremists who engage in harassment tactics. This is why we need House Bill 408 to become law. Thank you.
Thank you, Amanda. Finally, I'd like to introduce Jaime from NARAL Pro-Choice Ohio. Jaime is the Deputy Director and lobbies for abortion rights and increased reproductive health care for those who need it in our state. Please join me in welcoming Jaime.
Thank you, Allie, and thank everybody for coming today. It's so amazing to look out and see such a great group. I stand here with all these other leaders and activists to affirm our support for access to abortion care in Ohio. We stand here for people who need access to this care and for all of those who have lost access under Governor Kasich's witch hunt of abortion providers. Last fall, when legislators in the House introduced our Access Without Apology legislative agenda, they laid out a comprehensive platform to ensure Ohioans have access to safe, legal abortion care, to remove barriers that patients face, and to protect providers from medically unnecessary regulations aimed not at protecting patients, but instead at closing the only licensed provider in communities across the state. But instead of acting on that agenda and ensuring that Ohioans have access to healthcare services they need, we are here once again as this governor is poised to sign yet another restriction, his 17th to be exact, on abortion and access to preventive health care in our state. And once again, Kasich and his buddies in the legislature don't care about the collateral damage that is occurring because of this crusade against abortion. This time, this bill even is willing, with this bill, he is even willing to defund local health departments, federally qualified health centers, to complete his mission. Kasich's reckless campaign to attack abortion is already impacting the health of Ohioans. People are crossing state lines to get access to abortion care they cannot obtain within our borders. Ohioans are being forced to delay abortions for weeks because Kasich and this legislature have closed half of our abortion providers. And as Amanda said, when people finally do arrive at the clinic, they are met with harassment and intimidation from those who oppose their personal health care decisions. This is not what Ohioans want, and this is not what Ohioans deserve. In fact, a recent poll found that overwhelming majorities of people want abortion to be safe, respectful of a woman's decision, supportive, affordable, and available without shame in her community. These are the values that you all are talking about and we are talking about today. And we urge Governor Kasich and this legislature to focus on what the people want, those values, rather than to continue to attack abortion access in our state. Thank you.
Urge activists are doing amazing work all throughout the State House today. Our presence here and all over the state sends a message that we care, and young people really care. We care about our issues and our health, and we care a lot about the future of Ohio. Now it's time to show our lawmakers just how passionate and enthusiastic we are about reproductive health in our state. Again, thank you all so much for coming. This is the largest Urge Advocacy Day we've ever had in Ohio, with over 70 activists throughout the State House talking to their representatives today, and I could not be more thrilled. Good luck with all of your meetings, and take the energy and support from everyone in the room with you. Thank you.